Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.
We need to continue to do all of these preventative measures until we get a vaccine.
Important advice from an infectious disease doctor as we enter phase 3.
I just can't imagine people not taking it serious because it killed my daughter.
A mother still grieving for the daughter she lost to the coronavirus.
It's supposed to be the most apolitical thing that we do.
Making sure you're counted in the 2020 census.
We're having to recalibrate ourselves.
Our reality of water rising in places it never did before. Hi everyone, I'm Natasha Williams.
And I'm Andre Morrow. Much more on those top stories in a moment on this week's edition of SWI.
But first, let's get an update on the state's coronavirus numbers. The state has surpassed 160,000 cases and more than 5,100 people have died from the virus. Currently, more than 600 remain hospitalized.
There's also news that a tropical depression, number 22, has formed in the Gulf. We'll keep our eyes on that. Right now, a rundown of other headlines, beginning with what we thought would be another hurricane hitting our state.
Hurricane Sally exploded with power in the Gulf and was almost a huge problem for Louisiana. Our fragile southeast coast was battered for days with storm surge, but Sally made a sharp turn for coastal Alabama and Florida, and they caught her wrath. 105-mile-per-hour winds that knocked out power for more than 500,000. Several feet of rainfall that combined with surge put 5 feet of water in downtown Pensacola. Hundreds had to be rescued from high water. Big news about voting. A federal judge ruled Louisiana must reinstate the coronavirus pandemic voting plans of the summer and throw out a more restrictive plan the Secretary of State and legislature wanted. The governor called it a victory for our health, safety, and democracy. There's a new chair of the state's Democratic Party. Katie Bernhardt won the seat and plans to deliver an aggressive plan to give the party new life and new leadership. She says leadership that reflects the diversity of our state. Business analyst Lauren Scott calls it the toughest forecasting market we've ever faced. He presented his annual economic outlook for the state amid the ongoing pandemic. Job loss is huge, with Metro New Orleans and Lake Charles taking the worst hits and Baton Rouge right there with them. He says state government has shielded the capital region from more loss, and throughout the state, he warns recovery won't be quick, taking years. The diagnosis of 3 horses with Eastern equine encephalitis means owners need to have their horses vaccinated against the often fatal disease. Mosquitoes have been in force, especially since Hurricane Laura, with thick clouds of them delivering deadly bites to cattle, deer, and horses.
Now, what researchers at Baton Rouge General say could predict how different people respond to COVID-19. They discovered a simple taste test that could provide your level of sickness if you were infected. How long does this take?
Probably 30 seconds.
30 seconds.
Yep.
Baton Rouge rhinologist Dr. Henry Barham already knew a common cause of the loss of taste and smell was a sinus or viral upper respiratory infection. When it became known a hallmark symptom of COVID-19 was a new loss of taste and smell, he decided to take a closer look and became the first to apply how a person's taste receptors relate to their body's immune response to COVID. The taste test puts people in one of 3 groups: non-tasters, super tasters, or tasters.
It's not a treatment. It's more of information that you can know how you can live your life and whether you need to continue to do things to protect yourself.
So which group was I in? I was about to find out.
Basically, I'll just give you a couple of strips of paper, and with each one, you just basically lay it on your tongue and suck on it to try to induce a taste. And then you tell me, do you taste sweet, salt, bitter, or nothing?
I didn't taste a thing. But the test wasn't over.
But you just lay the second one on.
Just
Same,
in
same
your
deal.
mouth.
Yep.
Okay.
Nothing. And on the third,
Nothing on that one.
Mm-mm.
Okay. And so that's normal. So that there are 3 groups, and basically based on this, it has you as homozygous for non-functioning receptors, so the non-taster group. And so what does that mean? I see the look on your face. It means that, so as what our data would suggest is that group appears to have a longer duration of symptoms and more severe symptoms if you were to get it yet.
on the other hand, the super tasters can detect bitter flavors, and if they get COVID, they're likely to be asymptomatic. Everyone else is in between those extremes, and their symptoms would be mild or moderate. Dr. Barham had the first study published in the International Forum of Allergy and Rhinology, and it involved 100 patients. Based on the taste test, the results showed 100% of the non-tasters, like me, needed hospitalization. A second, broader study is underway, with the ultimate goal helping us much better manage this virus that has rocked our world.
On a large, national level, we could potentially predict who's going to get it and who's going to be fine versus who, is in the group that is more at risk for having longer duration and worsened symptoms.
The mask mandate and social distancing is still required, but the governor has lifted many of the restrictions of reopening the state's economy as we move forward through phase 3. We talk with infectious disease specialist Dr. Catherine O'Neill for a closer look at what it really means.
Dr. Catherine O'Neill is an infectious disease specialist at Our Lady of the Lake Hospital in Baton Rouge and says we are far from out of the woods in our fight against the deadly coronavirus.
Yeah, we're entering phase 3, and I guess for a lot of people that could signal a lot of things, but everything that I'm reading is saying basically this virus is still out there, it's still serious, and we still need to do all the things we can do to prevent it.
That's right. So we haven't found a solution to this virus yet. We haven't found a vaccine, so we have no herd immunity yet. All we have right now are preventative measures, and we found some ones that work really, really well, like masking and distancing, and we now have great studies that show that those things are actually very effective. So instead of just opinion that we think this is the best way forward, we know that it is the best way forward. But what we don't have yet is we don't have complete acceptance of those things in all parts of our lives. And so that's why we saw our numbers drop after universal masking. We didn't see them drop to the extent that they dropped when we stayed at home. And so we do need to remain very aware of the virus. It's still in our communities, and some of our communities that we still have really high percentages, which the governor mentioned last week. In our region, Region 2, we have greater than 10% positivity, which means that in any gathering, whether it's at work, at Subway, in the line, you have the likelihood of being in the line with somebody who's positive. And so by driving that percentage down to less than 5%, your likelihood decreases and spread decreases. So I think our numbers are better than they were in July by far. They're not where we want to be, and we need to continue to do all of these preventative measures until we get a vaccine.
We have these numbers that are still not where they need to be in many areas, and kids are heading back to school, kids are heading back to college, and people are, now thinking we're in phase 3, maybe I can do more. Not a good recipe, right?
Yeah, I think that in many ways, just 1 + 1 doesn't always equal 2. And in this, that's exactly the way it is. So you and I spoke very early on in this pandemic. And when we did, I was in the ER at the hospital, and I've been at work more days than I'd like to, right? Since that time. But I think the key is I've been at work. And so those of us who our offices couldn't close, and those of us who were in industries where we came back very early, we've been practicing better measures of prevention all of this time. So as our kids come back to school, am I fearful? I'm cautious, but if we do it right, our kids can come back to school safely. We've seen some schools open with really safe plans. So I think that with each reopening phase, it's not let's reopen and go back to what we did before. It's can we reopen cautiously? Are we following the numbers to make sure that our plan is the safest plan? And if we can do that and it works, great. Let's keep reopening cautiously. We're not dropping masks. We're not dropping social distancing. We're incorporating those things into each phase of the reopening.
And Dr. O'Neill says robust testing is still very important.
Testing is a great way to gauge, are you safe? So we just talked about how I think we can bring schools back safely. I think that we have really great plans, but how do I know that that plan is safe? And that's through testing. If I don't have enough broad-based testing of symptomatic and asymptomatic people, then I don't know. I don't know whether the person who got admitted last night got it from their school-age kid who lives with them, from the baseball field where they go to play ball, or they got it at work. And the only way that I'll figure that out is to have enough testing spread across the community that we can find the pockets of where the disease exists. It may not be school at all, and I would hate for a school to close because we think it's school when it's really because of office-based practices that aren't going great. So testing is the way that we continue to figure out who's doing a great job and who isn't, and help re-educate and realign those things that are causing spread to right themselves.
And testing goes hand in hand with contact tracing?
Absolutely. So what we just mentioned, so I have a patient who comes in last night, they have an extended family, they do a lot of different things in the community. They say, I always do things safely. How did you get this infection then? And so then we go back through contact tracing and we discover whether it was the restaurant I ate at, the school that my kid goes to, the baseball park where I play ball, or my work environment. And only through contact tracing can we figure that out. And what we're going to find when we figure that out is that there's more than one person that got infected that day.
Now, Dr. O'Neill and other health experts say it's very important to answer the call from contact tracers. It's a number you see on your screen and could dramatically help stop the spread. Dillard was a doting mom looking forward to giving birth to a new little baby girl when she began getting sick. She would give birth to baby Morgan, but would never get to meet her. We spoke with Kaylin's mom, who is struggling with the loss of her daughter, who had her whole life ahead of her.
The pain is still very fresh for Karen Denman, the grandmother, who is now mom to her daughter's 2 children, an infant and 9-year-old.
It's kind of scary. It's kind of scary that people aren't taking it serious. For me to have to lose a daughter behind this virus, and so many people just want to get out and have fun. My daughter doesn't have that opportunity to do that. So I have to visit her at the cemetery instead of being home with her family.
This is Kaylin Dillard, a mom to 9-year-old Kalea, and 8 months pregnant with a baby she wanted to name Morgan, a baby she would never get to meet. She lost her fight with COVID-19 shortly after giving birth to her new baby girl.
Kalea, which is 9, her oldest daughter, at least she had 9 good years with her mom. Morgan won't have that opportunity. Kaylin never had the opportunity to see her daughter, even though she carried her for 8 months. She had her at 36 weeks. But now Kalea is going to have to tell Morgan all the good things about their mom. So it's been very difficult mentally, physical, emotionally, not having my daughter for somebody that you talk to every day. And I just can't imagine people not taking it serious because it killed my daughter.
Kaylin, who worked with the disabled, was just 29 years old, but had asthma.
You know, the mask, sanitizing, you know, washing her hands, and everything that we thought was the right thing to do, you know, but it's telling me that you can't ever be too safe. You know, you have to take it to another level and wear your mask, stay home, you know, because you don't know what that other person may have, asymptomatic, you know, and it did hit Kaylin pretty fast.
It was just 2 days after her social distance baby shower that she was rushed to the hospital.
She tested positive. They ended up taking the baby on the 29th of July. She was supposed to have on the 26th of August. And then at that point, she ended up going on a respirator the day that she had the baby. You hear of a lot of people that's on a ventilator that, you know, gets off and, you know, they survive, you know, but Kaylin wasn't one of the fortunate ones. And I think she fought a good fight. She really tried, but it wasn't good enough.
Denman says making the situation even more difficult was while her daughter was fighting for her life, she, along with several members of her family, also caught the coronavirus.
And it was at the point to where Kaylin was in the hospital. I'm here sick. I couldn't go see my child, I always wondered if I would have been able to be there sooner than I was. Could she have made it, just to hear her mom's voice and, just it's so many what ifs.
She says the loss of her daughter is a pain she will bear forever, and it's her hope that others will think about how they would feel if they were in her shoes.
When you hear people talk about, this is no big deal, we just need to open up our country, we got to move on, we got to fight through this, how does that make you feel?
Makes me angry. Maybe they never had a loved one to pass or someone that they really, really care about. I think if they were to close their eyes and think if they have kids or someone that they really, really love, if they close their eyes and just imagine that person gone and not here anymore, I think they'll get the picture.
The family has set up a GoFundMe account to help pay for the medical bills and to care for the children. If you'd like to help, go to the page you see on your screen.
We've seen how COVID-19 disproportionately impacts African Americans. Blacks are more than 3 times more likely to become infected from the virus and twice as likely to die.
This month's Louisiana Public Square explores racial disparities in the areas of health, criminal justice, and voter access. Dialogue on Disparity airs Wednesday, September 23rd at 7 p.m. Visit lpb.org/publicsquare for more information.
The biggest challenge we have had is nobody was expecting or prepared for a pandemic.
That's Census official Tim Olson talking about how COVID has hurt this year's count. Early in the year, those forms were mailed to us to fill out and turn back. Well, how's that going? Nationally, about 89% have responded, but Louisiana and 5 other Deep South states are noticeably farther behind. Undercounting can cost states dearly, so there's a push to make sure that doesn't happen.
Stacey Abrams and Mitch Landrieu are political veterans and best-selling authors that are leading the fight to make sure the South gets counted when they wrap up the 2020 census in the coming weeks. Right now, drastic undercounting could lead to a decade of disaster for Louisiana, Mississippi, Alabama, Georgia, Florida, and South Carolina.
The census is how we allocate both economic and political power for the next decade. And we know that, particularly in the South, the effect of COVID-19, both the healthcare effects and the economic impact has been grave. If we are not adequately counted, we will lose out on those resources. And we're talking about the fair share that we would receive of $1.5 trillion every single year. But it also determines how political power is allocated in terms of redistricting and drawing the lines and the boundaries for everything from parish elections to city council to school board and as high as Congress.
This is one of the first duties of government, to count their people. It's supposed to be the most apolitical thing that we do. Although it's very hard to do, it's not complex. It is really just a matter of counting. And so when the first portion is done, secondly, you have to actually go out and knock on doors and find people, which is the process that we're in now. If you shorten that process, you're really politicizing the census count.
Some people that are hesitant to count themselves because they may not be legal. They may feel like they have too many people living in a house. Just touch on that reality.
That is a real fear, and it's a fear that was stoked very early on because the Trump administration made an overt effort to actually designate people's immigration status. Your immigration status is not asked for. Of course, the count and the Constitution basically says we count every person irrespective of status in the United States of America. The data is private, it's protected. I know people are nervous about it because there was a lot of noise early on, but that issue has been settled. So people don't have to worry about that. We want to encourage them to come forward, get counted so that they can count. We can actually have the resources necessary to take care of every human being that happens to be in the United States of America.
If you think about the communities, the parishes that make up Louisiana, the counties and cities that make up the South, we know that the South has been disproportionately hit by COVID-19, that our communities are facing harder economic challenges and harder healthcare challenges. The problem is that the recovery is going to be based on who gets counted. And so if instead of getting money for 4 million, we only get the resources for 3 million, or if instead of getting the resources for hospitals, you don't get the resources at all, that means recovery is going to take a lot longer. But this goes beyond government programs. It's also the same data that businesses use to determine if they're going to open up new jobs, if they're going to build new plants. And it's not just about what happens in 2021. The same information is used in 2026, 2028. And so for the next 10 years, if we don't tell the true story of what is happening, then the recovery is going to be slow. Not only recovery being slow, but any opportunities for growth will be slowed because we're starting with the wrong data. We're starting with less money and with less political power. And that means we're left behind for an entire 10 years.
You'll see a strong push over the next several weeks to fill out forms and be counted. For more info, go to censusinthesouth.org. That quote you see there about hurricanes in Louisiana is from LSU scientist Linda Hooper-Bui, featured in the most recent issue of National Geographic. Robert Twilley has studied the topic also for decades. He now heads the Sea Grant program at LSU. This week, I talked to him.
It's quite fascinating for a scientist in their own career to see the changes that, at the speed that we normally would have to document them from someone else's work. I mean, we can document change within our own careers, and that's pretty unique. And it's just a matter of not only the rate at which things are degrading, but may I also say that it's quite spectacular to see the growth, because I've also worked in the Wax Lake Delta. So during that same career, we've seen new lands built since I started my career, and you see lands that are disappearing during a single career. And so working right at that sort of divide of the Chaffalaya just to the west, where you see growth, and just to the east and Terrebonne, and you see, since 1932, the Gulf of Mexico has migrated 10 miles inland. At the same time, since 1932, the Gulf of Mexico has not moved at all around Morgan City. So if you live in Morgan City, the Gulf of Mexico is the same distance from you as it was in 1932. If you live in Houma, the Gulf of Mexico is 10 miles closer to you than it was in 1932. Those statistics that I just rattled off as far as the Gulf of Mexico migrating in for Terrebonne, that's the same for Barataria. It's the same for Breton Sound. Right. Now, you go into the what we call the Biloxi Marsh area, just to the southeast of New Orleans. It has not changed as much. It has not. The Gulf of Mexico is about the same location today as it was in 1932. But between Biloxi Marsh and the Chaffalaya, those three basins, Breton, Barataria, Terrebonne, have all had the migration of the Gulf of Mexico, all of them around the 10-mile area. And can I just put a footnote to Woody Gagliano, who passed away just recently. In 1974, he drew those same lines and predicted those magnitude of changes, and that's exactly what we've seen, in his career.
It doesn't seem that it has to be a storm that hits land in Louisiana. If there's a storm in the Gulf of Mexico that does any churning, certain places like Grand Isle, they're in trouble. It seems like.
Yeah, these, this is one of the major changes that coastal communities are seeing, is that we used to, it was the Cat 4, Cat 3, hurricane. Now it's the strong southeast wind. When a hurricane hits, like you said, over in Texas, in the Galveston area, for example, the effects of that, because of the surge from the wind of that storm by changing the wind conditions, can occur all the way to New Orleans, to the Mississippi, at the mouth of the Mississippi River. And so, not only are the frequency for any community increasing, but when a storm hits, you're still vulnerable even at a great distance from the storm. I know we're having to recalibrate ourselves. There's a couple factors that control storm surge. One is the the wind speed. That's one we know very well. The distance of which of water that wind is blowing over. But the third one is duration, and that is a big factor.
What have you found in the aftermath of Laura in the south?
Yeah, Laura was a very devastating storm, and it hit a rural area. I traveled over the Saturday after the storm and plan to go back this Saturday. We have our Sea Grant agents that have been, helping with the fishing communities and rural communities figure out what the needs are. We've been working with the Department of Wildlife and Fisheries, and it's a large wetland area. One of the aspects of the Cheniere Plain when it gets hit is that the surge rolls into this landscape over Highway 82 and the sort of Cheniere, areas of beaches, old beaches. And then it just like a bathtub, it sits there. And so I know there are a lot of efforts of trying to get the water drained. Until that water drains, it's really hard to see that scarring. As someone said, look, if it's piled up this big here, there's got to be a big hole somewhere. And to be honest, you don't really see those landscape features until the water drains, and it's still draining. And that's one of the real issues. And I'll tell you another complicating factor in that area is that water's got salt in it. And wetlands, muck decomposes faster when it has salt water around it. So the scarring effects of a storm on this wetland landscape, we won't know for quite a while. But if it's anything like Rita, it's there. But I want to emphasize, I always try to emphasize this to people that, when these wetlands and these delta landscapes have natural processes there to help them, they recover really well. I mean, they've gone through thousands of years of hurricanes. It's when we modify them and alter their hydrology, that's when they have a hard time coming back.
And everyone, that's our show for this week. Remember, you can watch anything LPB anytime, wherever you are, with our LPB app.
You can catch LPB news and public affairs shows as well as other Louisiana programs you've come to enjoy over the years. And please like us on Facebook, Twitter, and Instagram.
For everyone here at Louisiana Public Broadcasting, I'm Andre Morrow.
And I'm Natasha Williams. Thanks for watching.
Until next time, that's the state we're in.
Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.